Hi, Dr. Bassett. Thank you for joining me today. I understand that you're the director of the Women's Sports Medicine Center at the Orthopedic Institute in New Jersey. In your experience, do you see a difference in injuries between male and female athletes?
Definitely. So while injury risk may be comparable between the two genders, there are specific injuries that impact females more than males. The most notable one that everyone always talks about is ACL injury. Females have up to a 7 times greater risk of ACL injury compared to males, and this tend to be non-contact related to muscle imbalance and weakness. There's a multitude of differences, anatomic and physiologic, between males and females that leads to a difference in injury risk. You touched upon as non-modifiable things we really can't change with these athletes, and then modifiable, and that's really where we do an intervention to try to lower the injury risk. So more elevated Q angle due to a wider pelvis, which causes increased stress around the knee and increased valgus of the knee, which can increase risk of ACL injury and also the patellofemoral pain I spoke about. Females tend to have smaller muscles overall by cross-sectional area. They tend to have different fibers in their muscles, generating an overall lower power, lower muscle strength compared to males. Females tend to have shorter bones, smaller bones, and less dense bones, which increases their risk for stress fractures. And as you also mentioned, the joint laxity. So females, partly relating to hormone levels, tend to have an elevated joint laxity, which can predispose to injuries as well. And then for modifiable risk factors, that's really where we hope to make an impact. So females tend to have hamstring weakness that can predispose to ACL injury. They tend to land altered with more knee valgus, which can increase risk for ACL injury. Hamstrings compared to their quads, so they tend to land with more hip adduction, and which causes knee valgus. And a combination of all of this can lead to increased strain on the ACL. And so it's really important to address these risk factors, the ones that we can, to lower their risk of injury. I really want people to focus on prevention. So as a surgeon, I like taking care of ACL injuries. I like doing ACL reconstruction surgery, but I also don't like it because it's really devastating to these athletes to have to go through something like this. So every time I talk to athletic trainers or physical therapists, I always mention these prevention programs. And I think there's a lot of misconceptions out there as to how they should do these prevention programs, how they should implement them, how often they have to do them, how long, is it just a couple weeks? Is it just one time? Is it 6 weeks? So I always tell people about this app. It's free. It's called Play It Safe. You can download it on Android or the iPhone, and it's really simple. It basically goes through a structured program to minimize ACL injury risk in both males and females, but we know females that are a higher risk. It has videos that show you all the exercises that you can do, so it's really easy for coaches and athletic trainers, even parents, to implement this for their athletes to really decrease their risk of injury, and I think that's the most important aspect.
Coming up, there will be 5 major categories I will be focusing on today. Strengthening of the core, the hips and legs, and the knees, and we'll be touching upon some plyometric exercises, as well as going over techniques for deceleration and proper landing. There will be about 3 to 5 exercises for each category that you can easily complete on your own. Let's get right to it.
Hi, my name is Rob Agnoli with NJ Muscle, and today I'm going to demonstrate some movements for you that are designed for athletic performance.
Hi, my name is Janine Neal. I'm one of the owners and coaches here at Red Shed CrossFit, located in Flanders, New Jersey. And I've been within the coaching industry, fitness industry, for about 20 plus years now. I have a background in exercise science and sport management. Training females in particular is always important to build strength, especially to avoid knee injuries. I feel that most females don't have enough muscle on their body to help prevent some of those injuries. So what we try to focus on is really building up the muscle, focus on the core, the muscles around the knees to keep them healthy, and then incorporating a variety of training.
We're going to start with a simple plank. We're going to do a low plank, so we're going to use our elbows. So get down on the mat. I'm going to position my shoulders directly over my elbows. Feet back. I'm trying to keep my hips parallel to the ground. I don't want to get up too high, but I also don't want to sink down too low. My hips are parallel to the ground, shoulders over my elbows. My neck is nice and straight, keep my head still. And the key here is to squeeze your abdominals. Think about pulling your belly button in towards your spine to really activate your core.
Vertical crunches to strengthen your core. You're going to start with your feet up towards the ceiling. Think about pressing your lower back into the floor And from here, you're gonna reach up for those toes, squeeze your core, keep everything tight, make sure you exhale, bring it back down. So lift up, reach for your toes, core tight, bring it back down. Lift up, and bring it back down.
A great core exercise to incorporate into your training is a mountain climber. When I do a mountain climber, I'm going to keep my shoulders over my wrists, my arms nice and straight, my hips down. I also am using a pair of very common moving slides, furniture slides you can get at any home improvement store. This makes a mountain climber a little bit more challenging. I'm going to put my feet right in the middle of the slides. I'm going to put my hands down on the mat, shoulders over my wrists, hips down, head up, and I'm going to alternate legs, keeping the slides on the ground. Keep my abs nice and tight, my back is nice and flat. The conventional barbell deadlift. The bar is here, resting on the ground. I'm going to step up to the bar. My feet now are a little bit closer than shoulder width as opposed to the squat where feet were a little bit wider. Now we're moving them in about 6 to 12 inches apart. My shins are right up near the bar, very close. I keep my head up, my chest up. My arms are straight as I go down to the bar. Chest up, I'm going to drag this bar right up my legs, stand up nice and tall at the top.
Side lying abductor lifts. So from here, you're going to position yourself so you are aligned with your elbow and your shoulder. Your hips are stacked, a little bit of balance in the front here. And from here, what you're going to do is lift that leg up to about hip height, bring it back down. So working on the ability to move the muscles away from your midline, bring it back down. Everything is slow and controlled. It's going to work those muscles on the outer thigh. So just up and down.
The glute bridge, or hip thrust, is a great way to work your glutes and your hamstrings without as much lower back involvement. I'm going to do them across a bench. I'm going to use a medicine ball to provide some resistance. You can also do it with a dumbbell, a kettlebell, a barbell, whatever you might have access to. So I'm going to start by laying my shoulders across the bench. And I'm going to put my feet out, trying to keep my shins vertical. I'm going to take my medicine ball, put it low on my hips. As I drop my hips down, I'm then going to push up, trying to be flat like a table, parallel to the ground, squeezing my glutes. Down, up, get a good squeeze. Good squeeze to the top. Really trying to activate my glutes and my hamstring. Today with the squat. It's a knee dominant movement that works your entire lower body. A little bit wider than shoulder width. Your toes pointed out just slightly. I'm going to keep my head up, my chest up, and the first thing I'm going to do is push my hips back. So sit back and down, nice and low, trying to break parallel. So what that means is I want my hip joint to go slightly below my knees. Down, nice controlled movement, and come back up. Back and down, nice and controlled, come back up. Getting below parallel, what that does, that'll help the mobility in my glutes, my knees, and my ankles. That full range of motion will also help activate more muscle fibers and make the movement even more effective.
Single leg lifts to the front and to the side. So this is going to help focus on stability, core stability, and then also single leg strength. So if you start from the side, we're going to come up. All the weight is on your standing leg, hands on your hips. Think about looking at something straight ahead of you to help you with your balance. You're going to bring that leg up to about hip height, slow and controlled, bring it back down. So bring it up, bring it back down. Taking it out to the side, again, same thing. Load that weight on your standing leg, take it out to the side, slow and controlled, bring it back down. Take it out to the side, slow and controlled, take it back down. Banded lateral walks. If you do have access to a band, you're going to position it right below your knees. Feet are about hip width distance. You're going to lower yourself down into a squat. From here, keeping everything nice and tight, you're going to start to move in one direction. So you're going to take a step and close it in. Take a step and close it in. As you push off this way, you're going to be working those muscles in the outer hip, outer thigh, around the knee, and then just keeping yourself in that squat. It's also going to work your quads.
great plyometric exercise to incorporate into your training is a bounding broad jump. On the bounding broad jumps, I'm using that landing to propel myself into the next move. So I get myself set the same way, arms up, as well as my feet, forward, and then I immediately go right to the next one. Up, forward. So as soon as I hit the ground, I'm using that momentum and that stretch shortening cycle to propel myself into the next jump. It's a reactive movement. You're reacting off the ground. Almost think of yourself being on a trampoline. It's a great way to build explosiveness and conditioning in your lower body. Another great plyometric exercise for your lower body to incorporate in your training is a very simple vertical jump. There's a lot of different variations of this. What I'm going to do today is just a very simple shoulder width vertical jump, no steps. So I'll start my feet about shoulder width, my knees are soft, bring my arms up. When I come down, store up all that energy, I'm going to explode up as high as I can, reaching both hands into the sky. When I land, I want to land nice and soft, absorbing the impact.
Squat jumps. Adding a little bit of plyometric movement to your training, what you want to think about is having your feet right underneath your hips. You're going to lower yourself down into a little bit of a squat, really load those legs, using your arms for momentum, a little bit of a squat, jump up, explode, land in a squat with a little bit of a bent knee, and again, load those arms, get the legs going, explode up, and land into that squat.
We're going to talk a little bit about our landing and deceleration. It's extremely important for athletes to learn how to land in order to avoid injury during competition. So we're going to start with a depth jump. I have a 12-inch box here. I'm going to step up onto the box and stand right at the edge. Okay, I'm not jumping off the box, I'm just going to step off. And as I go down towards the ground, I'm going to land nice and soft, absorbing the impact of that landing. Nice and soft, absorbing the impact. My feet are shoulder width. I'm landing nice and soft in a good athletic position. Now, if I want to make this a little bit more challenging, I could add a plyometric component to it by doing a vertical jump after my depth jump. So I start the same way at the edge of the box. I step off. As I absorb that impact, I go right to my vertical jump.
Lateral jump side to side. So this is going to help with agility and balance. So what you want to think about is landing with a little bit of a soft bent knee to absorb the shock of the jump side to side. So starting here, we're going to jump over and jump over, jump back. If you want to add on to that, which you could also do side to side on one leg. Again, okay, take it over to one side, land low, side to side. So working on the ability to move from side to side.
I'm going to demonstrate the Pro Agility Drill, which is an excellent drill for working on your deceleration and your change of direction. Typically, I have these 3 cones spaced out 5 yards that way and 5 yards that way. But for our demonstration purpose, I have them a little bit closer together. I would start right here and then accelerate towards this cone. As I approach the cone, I'm going to decelerate, getting down nice and low, staying low, changing direction, heading back towards my far cone. Same thing, decelerating, staying nice and low, changing direction, and sprinting right back through the first one. This is an excellent drill for athletes to work on deceleration, change of direction, and accelerating back out. Deceleration braking drill is extremely important for athletes to learn to stop without coming to a quick halt where they can hyperextend a knee or run into another teammate or an opponent. Okay, it's important that they learn to decelerate, get down nice and low, and come to a stop. So we practice this. We set up a cone right there. And typically I'd start back about 10 yards or so I can get a good sprint going, but we shorten it up for the demonstration. I'm going to sprint hard towards my cone. As I close in on it, I'm going to get nice and low, pitter-patter my feet, and come to a stop right here in a good athletic position before I run past this cone.
Hi, my name is Taylor Squiers, and I'm currently a rising junior at Newton High School in New Jersey. For my Girl Scout Gold Award, I decided to make an exercise video that would allow teenage female athletes to strengthen their bodies properly yet effectively. As an avid athlete myself, it's extremely important to not only keep my body strong, but safe in order to reduce injury. As said before, the male and female bodies are completely different, especially in the lower extremity, and my hope is that girls my age can use this to not only better themselves, but reduce injury.